Hello people, in this video let us look at the syllabus of obstetrics for MBBS students. So basically obstetrics and gynecology together they will form one subject kind of a thing, but obstetrics is more about childbirth, right? So antenatal, etc. So basically this is about childbirth. Gynecology is more about the female reproductive system. So in this video we want to focus only on obstetrics, the syllabus. Okay, so they are telling it is all about family welfare, family planning. So at the end of this obstetrics course, you should be able to outline the anatomy, physiology, pathophysiology of the reproductive system, common conditions that affect it, detect normal pregnancy, labor, puerperium. What is puerperium? That is 6 weeks after childbirth. Okay, so you should be able to manage the problems, etc. in this. So leading causes of maternal and perinatal morbidity, mortality, you should know all this. You should understand the principles of contraception, medical termination of pregnancy, you should know sterilization like tubectomy, vasectomy, their complications. Then identify the use, abuse and side effects of drugs in pregnancy, that is teratogenicity, right? Teratogens. Premenopausal and postmenopausal periods, you should know all this. This usually comes in gynecology, isn't it? Then maternal and child health national programs, family welfare, all these programs you should know. You should then coming to gynecology, here they are saying common gynecological diseases you should know. Okay, you should know for cesarean section what are the indications. So cesarean section should not be done unless these indications are present. What are the techniques of cesarean sections and what will be the complications of a C-section. Okay, you should know about laparotomy, abdominal and vaginal hysterectomy. This again comes in gynecology, isn't it? So basically some gynecology is there here. Fothergill operation, actually this is to for the support of the uterus, isn't it? Fothergill operation. How's it going, guys? Now let us move to the skills that they expect you to know. So you should be able to examine a pregnant woman, recognize if it is a high risk pregnancy. You should be able to make these reference. You should be able to conduct normal delivery. Okay, normal delivery, recognize the complications, provide postnatal care. You should be able to resuscitate a newborn, right? And recognize congenital anomalies, you should be able to recognize. Then coming to contraceptives, you should be able to advise on these and assist in insertion and removal of intrauterine contraceptive devices, IUDs. You should be able to perform pelvic examination, diagnose and manage common gynecological problems. Okay, you should be able to early detect of genital malignancies. Okay, so cancer, etc. you should be able to detect. Make a vaginal cytological smear. So vaginal smear, perform post-coital test, wet vaginal smear examination for Trichomonas vaginalis, Monillia gram stain for gonorrhea. All these are STDs kind of, right? Monillia is fungus, Trichomonas vaginalis is a protozoa, isn't it? Gonorrhea is caused by bacteria, Neisseria gonorrhoeae, that is a gram-negative bacteria. So you should be able to read these reports of biochemical reports, histopathological reports, radiological reports, ultrasounds you should be able to interpret. You should be able to integrate all that you have studied till now, anatomy, physiology, etc., etc. So here are the knowledge that you expected to have. What's extra here in gynecology, this will come, isn't it? Menstrual abnormalities, etc. Infertility treatment. Okay, shall we move on? Now let us look at the actual syllabus, okay, course content. So vital statistics, mortality rate and all that, right? Infant mortality rate, etc. Birth rate, maternal mortality, perinatal and neonatal mortality, live birth, stillbirth, abortion, period of viability. All these are vital statistics. You should know all the vital statistics. You should know all these are in India what it is, in your state what it is. How are we different from the world and how much we have to improve, etc. Anatomy of the female reproductive tract, basic anatomy you should know. Physiology obviously of menstruation, ovulation, fertilization, implantation, gametogenesis. Yes, after gametogenesis only fertilization, implantation will come, isn't it? Basic embryology you should know, fetal growth, right? What are the factors that influence it, the development, anatomy of placenta, you should know, functions of placenta, etc. Teratogenesis, we told you, right? Teratogens, those anything that can cause a congenital anomaly, etc. Right? There could be drugs, radiation, etc. Now coming to placental barrier, the function of placenta, it is a barrier, right? Diagnosis of pregnancy, how do you diagnose a pregnancy? Like there are some probable signs, etc. Right? So many types of signs are there. Clinical features, differential diagnosis of pregnancy itself. Principles underlying the pregnancy test. You should understand how a pregnancy test works, antibody, antigen reaction, etc. To what? To HCG. Basically, these pregnancy tests that you get, the urine pregnancy test, they detect HCG, isn't it? And even in some kind of placental tumors, HCG can be more. So then again, same thing, ultrasound, and you should be able to interpret them. Immunological tests, right? You should know how to do, how to interpret the results. Maternal changes in pregnancy, you should understand what changes to expect in pregnancy. Genital tract, cardiovascular system, what change to expect, right? Hemodilution, etc. will be there. Hematology, what will happen to the blood, what and all components you're expecting to change. Respiratory and gastrointestinal system. Respiratory, the diaphragm, right? How it is getting affected. Gastrointestinal system, bowel movement, rectum, bladder, all these are affected. Antenatal care. So antenatal is what? Before the birth, right? Antenatal care. So basically, guys, when the lady comes to you carrying, right? Antenatal care, or it can even be before she gets carrying, where you have to give folic acid, etc. How's it going, people? Are you able to understand? Antenatal. Then after antenatal, what will you have? Perinatal. Then postnatal. Okay. So in antenatal, what will you do? You will try to detect any abnormalities, right? You'll assess the period of gestation. Then the gravida, para, all that you should know, right? Gravida. If she's currently pregnant, you will use this gravida. Para will be the beyond the viability, how many fetus she has carried, all that. So then a detection of normal fetal pelvic relation. So basically cephalic presentation, all that you will know, breech. Then nutrition advice. Then immunization against tetanus during pregnancy, right? Basic investigations, fetal well-being, biophysical monitoring, pelvic assessment for fetus. Let's continue, guys. Then you need to know about complications of pregnancy, abortions. Then what is incomplete abortion, inevitable abortion, recurrent abortion, induced abortion, right? Ectopic pregnancy, very important, right? You should know about this. Then trophoblastic diseases. So what are the trophoblastic diseases? Could be some tumor, right? Could be a lot of things. Let's move on. Ultrasonography, hyperemesis gravidum, right? Vomiting, hyperemesis gravidarium, okay? Gravidarum. Okay, pregnancy-induced hypertension, what comes here? Preeclampsia, then eclampsia. Eclampsia is seizures, isn't it? So preeclampsia can become eclampsia. Preeclampsia will be the hypertension and then it will become eclampsia, isn't it? So for preeclampsia, they say it should be after 20 weeks of pregnancy, okay? So then anemia in pregnancy, guys pay attention, how's it going? Anemia in pregnancy, right? Then how to treat it, all that you should know. Diabetes mellitus, urinary tract infection, all these are very important, right? Look at this now, gynecological disorders in pregnancy, like it be fibroid in pregnancy, ovarian tumor, retroverted gravid uterus, gravid is what? Pregnant, right? Retroverted gravid uterus, genital prolapse, pregnancy, genital prolapse in pregnancy, cancer cervix with pregnancy. So these are gynecological disorders in pregnancy. Normal labor, what and all you need to know about it, the physiology, the mechanism. You should know about partogram, they would have shown it to you, isn't it? So this is partogram, right, where they mark things to know whether it is going in the right direction or it needs some intervention. Conduct of labor, pain relief. Okay, this is all coming under normal labor. Normal pure perium, that is 6 weeks after the delivery. Continuing with some more obstetrics syllabus, some more topics. Antepartum hemorrhage. Antepartum. Antepartum, what is this? Before the delivery, isn't it? This is more like occurring not long before childbirth, okay? Accidental hemorrhage, placenta previa. So you should know all this, placenta previa. You've heard of all these, right? So here you can see the placenta covers the opening in the mother's cervix. So here you have the placenta previa, first degree, second degree, third degree and fourth degree. A better photo is there here. Look at this. First degree, second degree, third degree, fourth degree. Placenta previa. Okay, then abnormal presentation called prolapse, the umbilical cord, prolapse, contracted pelvis. All this you should know. How will you manage breech delivery, face and bro presentation? Right? All this you should know. Obstructed labor definition, you should know what it is. So, but there is some blockage, okay, though the uterus is contracting, right? Then that is what the definition says here. Then what is? Multiple pregnancies. Why this went here? Multiple pregnancies, complications, all these twin birth, etc. Induction of labor, oxytocin, all that. Preterm labor, guys, before 37 weeks, isn't it? What is this PROM? That's premature rupture of membranes. Rupture of membranes prematurely, okay. Post-maturity, that also you should know. Post-maturity, intrauterine death. Don't worry guys, we are entering the last section of this obstetrics syllabus, okay. Complications of third stage of labor. You should know the stages of labor and they are talking about the third stage of labor. Third stage is kind of after the birth, right? Okay, then PPH is what? Postpartum hemorrhage. Uterine dysfunction. Classification of uterine dysfunction. Recognition. So what is this uterine dysfunction? So abnormal uterine bleeding, etc. can come here. Okay, then fetal distress, fetal death. You should know the clinical features, causes, principles of management and prevention. Prevention mainly. Okay, then coming here, neonatal problems, resuscitation. Basically, they will teach even in pediatrics. So what is this RH isoimmunization? If mother is RH negative, right, and the baby is RH positive, they will do all this, right? Then fetal complications, you know, right? The kernicterus and all that. Abnormal puerperium. So you should know normal puerperium to identify abnormal puerperium, that is 6 weeks after the delivery. Okay. You have to prevent puerperal sepsis. Okay. Actually, there's a little more, guys. Sorry, I thought it was the end, but yeah, little more. Breastfeeding. How to care for breast. Okay. Breast abscess. All this you should know. How to care for a newborn. We'll go fast, don't worry. How to detect asphyxia, medical termination of pregnancy, family planning, contraceptive, vasectomy, tubectomy. Then operative, you should know episiotomy, right? For normal delivery, they'll do this episiotomy. Vacuum extraction, forceps, instrumental evacuation, menstrual regulation. Then cesarean section, assisted breech delivery. Then so many things. Post-cesarean pregnancy, after a cesarean pregnant. Okay. Then pharmacotherapeutics, oxytocin, antihypertensives, tocolytics. What will tocolytics do? These will suppress labor, isn't it? Like in threatened abortions, they can use this. Oxytocin actually is induction of labor. Anticonvulsants for all the eclampsia, isn't it? Then safe motherhood, etc. High risk pregnancy, you should know, like blood coagulation disorders, right? Then you should know the causes of maternal morbidity, mortality, and how to prevent. Medico-legal aspects you should know, like paternity and all that. Medico-legal aspects, what else can you think of from forensic medicine? Infanticide, female feticide, right? Daycare and obstetrics, reproductive and child health program, RCH. Then gender issues. So that's all we have looked at the syllabus of obstetrics in MBBS, okay? That's all for now. Bye-bye.